The School of Nursing, as well as Abington Memorial Hospital, are celebrating 100 years of service to this community, and so our history and legacy go hand in hand together over the past 100 years. And we've been fortunate that the school has been an integral part of who we are as an organization and as a member of our community, and is it important because it allows us to actually train the next generation of caregivers. And so it's been important for our patients in the community, it's been important for our strategy, and I think it's made a very deep and positive impact on our patients and the people we've been privileged to serve. They deserve a tremendous amount of credit and commendation for everything that they've done. It's been very, very special, and we look forward to a long relationship.
The Abington Memorial Hospital School of Nursing began when the hospital officially opened its doors for service to the community on May 15, 1914. At that time, the School of Nursing had 9 students and 2 faculty members. The course offered was 2 years in duration and afforded excellent practical and theoretical instruction. The first class graduated in 1916.
On behalf of the Alumni Association, as well as myself, I wish to congratulate the school and the hospital for 100 years of exemplary service.
Over the years, the nurse's role in medical care has changed dramatically.
I don't remember exactly when we arrived at the School of Nursing, but I know that in September of '54, I learned how to clean a bed. Not make it. That didn't come till November. So we learned how to arrange flowers and how to fill water jugs, and a lot of the things that are no longer in the purview of nursing today.
I do remember when we were in our bed making class that our pillows had to be turned so that the open end of the pillowcase was away from the door entrance, so that anyone coming in was presented with a nicely covered pillow and not the open ticking on the pillow case underneath.
We even had a Abington cuff. When I went to nursing to other hospitals to work, and I would fold the cuff of the sheet down twice, fold it under the second time, it was called the Abington cuff. And none of the other nurses that I worked with from other hospitals ever did that. They kind of looked at me like I was a crazy lady.
We learned to do every procedure not once, but 3 times. And we had a book. Before you graduated, you had to have completed all those procedures 3 times. And I remember running around on the floors with my classmates towards the end of senior year, making sure of what procedures we could find on the various patients so we could be sure to get all of our procedures done. Because you didn't graduate until you did pass 3 NG tubes, until you did give 3 soap suds enemas and 3 oil retention enemas, whatever. We did everything 3 times, everything.
We had a skills lab. It was in the basement of the Memorial Home, which is where we lived. There were about 8 beds, and pretty much we learned a variety of nursing skills, such as inserting a live-in tube, putting in a Foley, doing injections, giving a bath. And I would say most of those skills we did on each other. We did practice giving an injection to an orange, but we also gave injections to each other, and that was a challenge.
We had mannequins at the time. We would practice a little bit on each other. That would be more for assessment reasons, and or doing vital signs, blood pressures, heart rates. Injections, we would practice some on the mannequins. We would do some Foley catheter insertion, NG tube insertion, but we had nowhere near the amount of technology that they have now when you hear the current students talking about the simulation labs.
We would use a Sims mannequin as well, and the teacher would be behind a one-way mirror, so when we were getting blood pressures or pulses, the teacher would know if we were accurate or if we were just guessing on them. And it was kind of nerve-wracking because you knew somebody was looking over your shoulder the entire time.
The nurse is now a partner in an interdisciplinary team.
I certainly would love to extend my congratulations and those of your colleagues on the medical staff, both currently and from the past, to thank the nursing school for bringing us such wonderful talent and for being such wonderful partners in the care of our patients.
Nursing is a critical component of what any hospital does. And as we get feedback from caregivers, including physicians, and from patients, the first thing that they'll mention is the quality of Abington's nurses. And we're we're very proud of that.
The School of Nursing, along with the dormitory, was located in Abington, Pennsylvania. Dormitory life was a highlight for the student nurses in the early days. As the student population changed, the dorm was no longer necessary. The School of Nursing became a commuter school with adult learners. In March 1993, the school moved to its present location on the Schilling campus in Willow Grove, PA. This satellite campus is approximately 4 miles north of the hospital's main campus.
The relationship between the School of Nursing and the Women's Board is over 100 years old. The Women's Board was actually formed a year before the hospital was built and the School of Nursing was opened. We began fundraising for the hospital, and included in our mission is raising funds for educational needs. So we have been raising funds for nurses' scholarships ever since we began. We are almost 101 years old today.
We were actually socialized not only into being good nurses, but to be really good women. So one of the things that we did early on was the Women's Board gave us a tea, one of the first few weeks that we were in nursing school, and taught us how to act at a tea, how many cookies to take, and how to hold your cup.
We had a swimming pool. They used to stock your refrigerator. We all gained about 40 pounds our first year there or something. It was, you know, you would stay up all night, and it was just a fun, young adult time.
And my claim to fame as the president, and my fondest memory, was living in the dorm, and as president I was successfully able to have men visit in the dorm, unsupervised mind you, on Wednesday nights till midnight, and on Sundays till 6 or 10 o'clock at night, provided that when a man came on the floor, your friend or what have you, that you yelled "man on the floor," and alerted everyone that a man would obviously be there. That was my huge claim to fame.
So we all lined up in the hall, all the people that lived in the dorm, for this annual ride down the fire escape. So it was my turn, and you hold on and you just jump in and let go, and you spiral down 3 floors. But it really was not fun because it's all seamed as you go down, so it's a bump, 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 and your poor behind is going bump, 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 bump. And at the very end, you came out, and the house mother was outside to catch you coming as you flew down and out the door. And of course, everybody was holding their backsides at the bottom, and they're like, that wasn't so much fun after all. But the whole experience was a lot of fun.
Oh, living in the dorm was very interesting. I think young people today would flip if they had to do what we had to do. We had house mothers checking you in and checking you out, house mothers watching what you had on. For instance, we went to Penn State for our science classes, and we had to be in skirts or dresses. We were not allowed to wear slacks. If they did not like where you were going, your mother would get a phone call from these house mothers. There were very strict curfews. We were all, in senior year, we were allowed out till 12:30, 12 times, so 1 a month. We had 1 12:30 a month. And other than that, we had to be home by 10:30. Oh, and then we had Miss Green. And Miss Green, you had to weigh yourself every month. And Miss Green would call you in, and she would take a good look at you and see how she thought you looked, and she would discuss what you were eating and what you were doing and why were you crying or anything like that. She was very involved with how she felt things should be.
We did not have weigh-ins or any kind of physical conditions that had to be part of our training, but we were told by the Abington school nurse, Miss Green, who was probably 80 if she was a day at that time, that we would probably not be able to do our maths and science as well when we were having our menstrual periods.
In 1969, the School of Nursing graduated its first African-American student, Carolyn Marrow. Bob Glickman was the first male graduate of the school in 1980. Today, the student body represents a true cross-section of the community. School diversity includes men and women of various ages, races, creeds, national origins, sexual orientations, disabilities, marital status, and veteran status.
You know, when we sit around the table and look at the profiles of the students who've been selected to attend here, you see the various cases, you see and you understand and you feel people's goals and dreams, and it is really wonderful to be able to help support folks who may be struggling to raise a family, who may be changing a career, or for whom this may be, you know, their first shot at moving on to higher education. So it's a great feeling, and all the women of Dickens really appreciate and understand how important our role is here.
I chose Dixon because my parents are nurses, and they sort of influenced me about how clinical is very important in nursing education. So I learned that Dixon throws you right into clinicals fresh out the gate.
In freshman and intermediate year, we were given a patient load, and you had 4 or 5 patients that you were responsible for their total care. As a senior, we got to be the team leader for the floor. We also worked 3 to 11 shift and 11 to 7. And I remember on 11 to 7, we were the nurse in charge on the floor. You would have maybe another student nurse with you and an orderly, and that would be it. And you would have, 30, 40 patients under your care.
The patients that are in hospitals then compared to what's now look a little bit different. So you had a lot more patients, but they weren't quite as sick as they are now.
So in the beginning of nursing school, we just had that one patient that we could hyperfixate on, and then that pretty much stayed consistent our freshman year. And then our senior year, the first term, we took care of one patient, but then the second and third term, we started to take care of multiple patients, and finally taking care of a whole slot by the time we graduated.
Well, I want to congratulate the School of Nursing for its 100 years of service to the community. Nothing could be more important than nursing in our community, and you know that the most trusted people that speak for hospitals and speak for healthcare across the country are nurses.
It all started in the year 2000 when we went to meet with Dick Jones, who was the current CEO at the time. We always meet the Office of Philanthropy each year to talk about fundraising initiatives for the following year and what should be the priority. And Dick said, well, if I had my choice, we would fundraise to secure the future of nursing here at Abington.
The nation's nursing shortage prompted Abington Memorial Hospital to establish a $20 million nursing initiative to respond to the need locally to educate, hire, and retain nurses. Fitz Eugene Dixon Jr. gave a $5 million leadership gift to the school. In May 2001, the school was named the Abington Memorial Hospital Dixon School of Nursing in honor of Mr. Dixon's mother, Eleanor Widener Dixon, and his wife, Edith Robb Dixon.
And I want to congratulate the nursing school on their 100th anniversary. We are so proud, and from a fundraising perspective, you make my job easy. People are very grateful and very happy to give back to Abington because of the good work you do. Congratulations on your 100th.
As medical knowledge and technology advanced, so did the hospital environment. Everything from medication delivery to the idea of universal precautions was turned on its head in this fast-paced, changing world.
Well, we had Bunsen burners, and you had sterile water that you'd put on the spoon, and you had to put the syringe together, take it out of a package. Sometimes we had to sharpen the needles, and the patient got the results.
At that time, we didn't have a lot of medications. In 1950 to 53, we only had 2 antibiotics. We had penicillin and streptomycin. And we gave mostly, like in the evening, we gave laxatives, we gave vitamins. So we had a little tray, we put little paper cups, we dispensed the medications from a closet that had large bottles of all these different medications. If you gave a liquid medication, we used little ounce glasses. They were glass. So at the end of the shift, we had to wash out those glasses and make sure they were all ready for the next patients.
How medications came up were not originally unit dose. We sort of progressed to that during my 3 years of training. But when they started out, you know, the medications came up in a group, maybe 10 pills or whatever pills were needed for a couple days. They came and you literally poured them by putting 1 pill out into a little souffle cup, and then what all the patient was getting went into that cup, and then you went and gave that patient, you know, checking all the things that we're supposed to check. You mixed antibiotics in those days, and they might have 2, they might have 1, they might have more than that. You know, it all depended on what they were being treated for, but antibiotics was a very big time-consuming part of the medication nurse's responsibility to go back and forth to each patient with multiple IVs and only 1 line to run them through.
When we went to get medications, they were in an AccuDose where the teacher would basically put their password in and their fingerprint, and we would pull out the medications together and double check them at the AccuDose. And then going into the patient's room, we would once again double check them to the Cardex before we went in. and then again before we gave it to the patient, so we were always checking our medications every step of the way before we even got to the patient.
Nothing came prepackaged like it is today. Nothing was disposable. We used everything. And the rubber tubes that were used for catheterizations or enemas were all boiled in a big pot in the hopper room. And once in a while, you would forget they were there boiling and being sterilized, and they would boil dry, and somebody would yell, "Who left the rectal tubes on there burning?" and the smell would permeate the ward.
All through nursing school, we were basically admonished not to use gloves because that would make the person or the patient feel that we thought the patient was dirty or that we didn't like touching the patient or anything like that. And then the very last month before we graduated from school, the whole world changed, and OSHA came along and said all nurses will wear gloves when touching patients at all times, because that was at the beginning of the HIV standard precaution piece that required us to all wear gloves.
Universal precautions at the time when I was graduating probably is pretty similar to today. The assumption is everyone has some form of communicable disease, so you want to wash your hands, wear gloves, make sure that, God forbid, if you have contact with blood, that you have a glove on, or if you need to wear goggles, gowns, that type of thing.
On behalf of the Board of Trustees of Abington Memorial Hospital, I would like to extend a very hearty congratulations to the nursing school. We're very proud of the fact that this nursing school has reached 100 years. The board has always been committed to the nursing program, and it's been one of the outstanding characteristics of Abington Memorial Hospital.
I would like to congratulate the excellent work that the School of Nursing has done over the past 100 years to deliver and educate many, many nurses for this hospital and for our community.
From caps and starched collars to scrubs and sneakers, the student uniform has evolved.
Our uniform consisted of a blue and white striped dress with a bib and apron and a very, very stiff starched collar that many of us wore gauze pads around our necks to prevent the red marks that were there. All the uniforms were starched by the laundry, and they were great, but they were also very prickly.
The one in my right hand is called a Proby cap, and we actually wore it on the top of our head. So we wore this for 6 months where we were probationary, and then we got our caps. So the cap came flat, it got washed in the hospital laundry and starched, and then you had to fold it. The collar also was flat, however, you had to also take paraffin wax and wax that edge, otherwise you'd have slices on your neck because it was so sharp.
We had a pinstriped short sleeve cotton uniform with a bib and an apron with buttons. You had to put all your buttons in. Nothing was snaps or anything. We had a collar, a stiff collar that we would put on top of the uniform and pin to our bra to keep it down.
We wore our scissors around the crisscross of the apron in the back of the uniform. That was part of the uniform. Every nurse had their nurse's bandage scissors.
We were the first year to initiate, I think it was the polyester part of the uniform. We had a blue, really tiny pinstripe underdress, and then we had the white bib. We didn't have to really iron it generally. No, it wasn't the starched kind that our big sisters and those before us had.
The guys had a matching sort of smock that the girls had. It was basically sort of like a scrub top with 2 pockets. It was still the thin blue and white stripe. White pants, white belt, which is difficult to find. We were supposed to wear white shoes, but I basically got permission to wear white Converse sneakers just because I couldn't find a pair of white shoes that was going to make me comfortable.
It was blue with buttons and then this ruching in the back with buttons and white pants. The men got to wear plain scrub tops, but we had this fancier version of a top. White shoes, white socks. The other requirements we had to have a stethoscope, we had to have a watch with a second hand. working pen, perhaps, but that's about it.
Men and women wore identical uniforms, and it was a blue scrub, blue bottom and like a top, regular scrub top. In addition to that, we had white jackets that we wore.
Interestingly, when I was in one of my graduate courses, we were actually doing a project on the role of the professional nurse, and I was actually with a younger nursing student, and we decided to dress up and identify the roles. And so long story short, I wore my uniform and my cap and my cape, and he wore his scrub suit, and he had a fanny bag. And one of the students said to me, "Where did you get that cape? In an antique shop?" And I said, "No, I got it in my closet."
Since 1914, the Abington Memorial Hospital Dixon School of Nursing has graduated thousands of students who have gone on to serve the local community and beyond as professional nurses.